Alright, in this section, and this is the last section, second to last section in chapter 17 and 18, we're going to talk about communication and perception and communication disorders. So, there's a little diagram, and it's from chapter 17. It's on page 425 if you want a bigger picture of it than what's in the module. And it talks about the flow of information during conversation from hearing speech to replying. And so this is actually very similar to the one that we talked about in the last section in the localized areas of the cerebrum in processing sensory information and responding to it. So obviously listening and speaking communication is processing sensory information and responding to it. It's just a specialized area of doing that. So the first thing that happens is the primary auditory cortex performs auditory discrimination. It says, I hear something, is it loud, is it, what's the pitch, what's the volume, and it passes it on to the secondary auditory cortex. The secondary auditory cortex says, is it language, is it music, is it noise, what's going on? And it says, hey, it's language. Wow, that's cool. I have a special place for you to go. So it sends that language to Wernicke's area. So Wernicke's area is the sensory association area for speech. Okay, so it's involved with auditory comprehension, vocabulary, so it's memories, remembering the meanings of words, remembering the context of words, remembering emotions associated with words, right? So that's like that sensory association area, but this one is specific for speech. So then it goes, there's a link between Wernicke's area and Broca's area, and Broca's area is the motor planning area for speech. These subcortical connections, so it's subcortical white matter that link Wernicke's and Broca's areas. So the reason that is separate on this little flow is because you can have disorders that affect that link between Wernicke's and Broca's, and that can disrupt communication and perception. Next it goes to Broca's area, which is the premotor planning area for speech, and that formulates the instructions for language output. And this is all in the left hemisphere of the brain. And then it goes to the oral and throat region of the sensory motor cortex, and it sends up the cortical output to speech muscles. So those are the upper motor neurons specifically for those muscles of speech. Okay, so this is very similar to that pathway we talked about in the last section, but this is specific to speech. So we have areas in our brain that have developed specific to listening, understanding, and speaking, which is just super cool. I love that. So the comprehension of spoken language occurs in Wernicke's area. And Broca's area provides instruction for language output. So it's planning the movements to produce speech, grammatical function words such as articles, a and the, those sort of things. And so each area has its own processing that it does. And so disorders in those individual areas can cause different types of effects. So we talk about communication and perception. Perception is the interpretation of sensation into meaningful forms. So it's an active process requiring interaction among the brain, body, and the environment. It involves memory of experiences, motivation, expectations, selection of sensory information, and active search for pertinent sensory information. So there's a lot going on with perception. Spatial perception happens in the area corresponding to Wernicke's area in the right hemisphere of the brain. So that area of the brain provides schemas for the body. So there's a mental representation of how your body is anatomically arranged. It also provides a schema for the body in relationship to its surroundings. It enables us to locate objects in space and to navigate accurately. And it also provides a schema of the external world. So it's the ability to plan a route from one site to another. So a lot of times when you're doing stroke rehab with someone, you are working on these things. You're working on navigating, locating objects in space, route planning from one site to another. You're doing mirror therapy for the representation of how your body is anatomically arranged, because that part is interrupted when you have lesions in different areas. So we talk about the different types of aphasia, and aphasia means difficulty speaking. And it's different from dysarthria. Dysarthria is actually difficulty with the muscles, so it's either that spasticity or flaccidity of the muscles of speech. The aphasia actually happens in either the receptive or the motor planning areas of the cerebral cortex. So in Broca's aphasia, someone with Broca's aphasia has difficulty expressing themselves using language. So it's not just speech that's affected, it's also writing. So they usually can understand you, and they can sometimes produce automatic phrases like yes, no, hello, I'm fine. A lot of times during rehab, they're working with a speech therapist, they develop a sort of a selection of phrases that they can use, which is really nice. Sometimes you'll work with someone who has Broca's aphasia and they say yes, yes, all the time, yes, yes. And so no matter what you ask them, the answer is yes, yes, because that's what they can say. So you have to really tune in to what's actually going on with them. Some people with Broca's aphasia, if they're upset, they might be able to swear. I don't know if swearing uses a different part of the brain, but I think that's kind of cool. And sometimes they can make short, appropriate statements. I was working with this guy with Broca's aphasia, and he was trying to tell me that his middle name was Broca, and so he thought it was kind of humorous and somewhat appropriate that he ended up with Broca's aphasia after his stroke. Well, you can imagine if you had difficulty producing that, how hard it would be to express that small amount of information. So the way it sort of came out, and I'm not very good at this, but I'll give it a try. He said, name, middle, and he's pointing at his chest, and he says, Broca. And then I said, your middle name is Broca? And he said, yes, yes. Okay, there's that yes, yes. And he really did mean yes, yes in this case. And then he said, funny, and then he points at his chest again, Broca's. So he meant it was funny that he had Broca's aphasia. You know, so it was funny, and we both kind of laughed about it. But so people with Broca's aphasia, they can communicate, but they have trouble getting the words out. And a lot of times they can just use short phrases and no articles and that sort of thing. And grammatical construction is difficult for them. They're very aware of their disability. Usually writing and speaking are impaired. Besides being called Broca's aphasia, it's also called motor aphasia, expressive aphasia, or non-fluent aphasia. So there's a video that's 2.5 minutes long showing a patient with Broca's aphasia. It totally looks to me like it was videotaped in the 70s. It just has that look to it, that real sort of old black and white weird look to it. But it's an excellent representation of someone with Broca's aphasia. It's actually a real person with Broca's aphasia. And a lot of times people with Broca's aphasia can be very frustrated by their inability to get the words out, because they can understand, they know what they want to say, and it's just really difficult for them to get the words out. Okay, on the other hand, Wernicke's aphasia, language, the motor part is fine, but language comprehension is impaired. So this person, Wernicke's aphasia is also called receptive aphasia because their comprehension is impaired. It can be called fluent aphasia or sometimes sensory aphasia. So fluent, meaning they can produce fluent speech, but it's meaningless. Their hearing's normal, but they can't comprehend the spoken language. As opposed to the people with Broca who are very aware of their disability and often frustrated by it, people with Wernicke's appear unaware of their disorder. They can't read or write. And they talk blah, 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 and it might be sort of nonsensical, meaningless. There's another video of, it's sort of in the same video group, of someone with Wernicke's, and it is really interesting. At one point she said, "Oh, you were a dentist, weren't you?" And he says, "Oh yeah." Blah, and she said, "Well, how long did you practice dentistry?" And he says, "Oh, hundreds of years," or something, something that was sort of nonsensical. And then she says, "Well, where did you practice?" And he like points to his mouth and he says, "Oh, right here." Like he practiced dentistry in the mouth. Well, sure, that sort of makes sense. But when you watch it, you can see the difference between the person with Broca's and the person with Wernicke's. So they have trouble understanding and comprehending, but they have this fluent. They easily produce fluent, meaningless language, and they're unaware of their disorder. So when you watch the video, you'll see the guy, he seems like he's just ever so pleasantly having this conversation with the therapist, and he doesn't seem to be aware of the fact that he's saying really strange stuff. On the other hand, someone with Broca's, they would be getting out a few words, and they would be very frustrated by the fact that they could not express themselves the way they wanted to. So it's quite interesting. So we talked about the subcortical connections that link Wernicke's area and Broca's area. So if those are affected, if there's damage to those neurons, you have what's called conduction aphasia. So speech and writing are unintelligible, but they're able to understand written and spoken language. So it's like, you can think of it sort of like an electrical circuit. It gets to Wernicke's area, so it gets to the understanding part, but then it never gets to the motor processing. So they can't speak and they can't write, but they can understand written and spoken language. And then global aphasia is unable to use any form of language and unable to produce or comprehend language. So that's really difficult. And obviously there's widespread damage with that one. They can't understand and they can't produce language. So there is a phenomenon that's called neglect, and we talked about it a little bit in the last chapter. With regard to brainstem disorders and some of the other things, but the definition of neglect, it's the tendency to behave as if one side of the body or one side of space does not exist. And there's a little video on spatial neglect which is sort of interesting. There are some pictures in the book where they talk about, it's on figure 18-7, signs indicating neglect. So there's 5 or 6 different things, tests that a speech therapist might do, or an occupational therapist. It's usually speech or occupational therapy that are doing these kind of testing. So the first one, the patient's asked to read a paragraph, and they miss all the words on the left, so they obviously have visual neglect on the left. Or they're asked to draw a clock, and they get all the numbers in there, but they're all on the left side of the clock, or they're all on the right side of the clock. So it's obvious they're not paying attention to that left side. And then some of the things where they're asked to reconstruct a picture or something like that, and it just doesn't come together in the way that you would expect. So visual neglect is not the same as homonymous hemianopsia. With visual neglect, you actually have the capacity to see, but you do not have the capacity to pay attention to what's going on over there. So they may or may not have a loss of visual field, but they're not compensating because they just can't mentally attend to that side. So a lot of times you can work with them in therapy to try to work to compensate, to have them turn their head, so if it's a visual field issue, or to pay more attention to that side. So damage to the area in the right hemisphere that's analogous to Wernicke's results in lack of spatial awareness to that side. So there's a video that describes a patient with visual neglect, and it's pretty interesting, and I've actually seen this quite a lot in patients, post-CVA patients. And the other day I was lucky enough to have my favorite therapy dog working with me, and one of the occupational therapists was working with an inpatient rehab patient, which is their unit is upstairs in the same building as our outpatient unit, and they share our gym sometimes. And she asked if she could borrow the dog to work with her patient, and I said sure. So I went over there just to check out what they were doing, and so the side that was the neglected side, she had the dog sitting up on the mat table next to the patient, and she had the patient put her hand on the dog, and that was her affected, motor affected side as well. And she kept on cueing her, pet the dog, pet the dog, look at the dog, she kept on using the dog to sort of focus the person's attention over there. So it was really neat, and I love working with therapy dogs, but that's just kind of one little therapy moment on someone with neglect. So there's a little table from Chapter 18 on communication disorders, and it talks about kind of what people can and can't do with different communication disorders. So dysarthria, we know it's a motor neuron issue, either upper or motor neuron, and they lack motor control of speech muscles. And they can comprehend spoken speech. They cannot speak fluently because they don't have that motor control. They can use grammatical words normally. It's just hard for them to get the words out because of the motor control issues. They can read and write, and it's the lower motor neurons or cortico-brainstem neurons, the upper motor neurons of speech, that are causing that. So in Broca's aphasia, it's also called motor, expressive, or non-fluent aphasia. Grammatical omissions and errors, short phrases, and effortful speech. They can comprehend spoken speech. They cannot speak fluently. And they can produce meaningful language, but it's not, it's difficult, and words are missing. So it'll be short phrases. They do not have normal use of grammatical words. They can often read, but they cannot write. And Broca's area is the structure involved in the left hemisphere. Wernicke's aphasia, also called sensory receptive or fluent aphasia. The person cannot comprehend language. They speak fluently but unintelligibly. And they cannot comprehend spoken speech well. They can speak fluently, though. They have that fluid, normal sounding, normal pacing and tone and everything of speech. They can't really produce meaningful language, though, because they're not comprehending. They don't use grammatical words normally because they're producing unintelligible speech, and they can't write. And the Wernicke's area is the structure involved in the left hemisphere. So conduction aphasia is also called disconnection aphasia. That makes sense. Wernicke's isn't connected to Broca's, and the person understands language, but there's no intelligible language output. It makes sense. It's like the electrical circuit that is interrupted at the in between the understanding and producing language phase. So they can understand speech, they can speak fluently, but they cannot produce meaningful language, and they can't use grammatic words normally because they can't produce the meaningful language. They can read, but they cannot write. So incoming, yes. Outgoing, no. The neurons connecting Wernicke's and Broca's are what are affected. And then global aphasia, it's also known as total aphasia. The person can't speak fluently, they can't communicate verbally, they can't understand language, they can't read or write. They can't comprehend spoken speech. They can't produce meaningful language, and everything is affected. Wernicke's, Broca's, and the intervening cortical and subcortical areas. So there's another nifty little chart. This is what you should know for the exam. So cerebral area, what its normal function is, and what its disorder is. So Wernicke's, Broca's, neurons connecting Wernicke's and Broca's, right hemisphere corresponding to Wernicke's, right hemisphere corresponding to Broca's. Global aphasia affects all of those things in one hemisphere of the brain usually. So that is really, that's what you need to know on communication disorders for the exam. So in the last section, we will talk a little more specifically about traumatic brain injury and stroke, or CVA, cerebrovascular accident. And that'll be the last part of chapter 17 and 18, and then we'll briefly go over chapter 19, and that'll be the last of the lectures for the entire class. Pretty exciting, right?